Good morning, friends. Today, I am going to present before you an important remedy in our homeopathic materia medica, Silicea or Silica. Silicea or Silica is chemically known as silicon dioxide, and its chemical formula is SiO2. Silica is not so much a reactive agent chemically, but our great master animal potentized and dynamized Silicea according to homeopathic pharmacopoeia and converted it into an important remedy in our homeopathic materia medica. And we homeopaths are prescribing this medicine and curing various acute and chronic diseases in our day-to-day practice. Now, what are the points to be kept in mind to identify a Silicea patient? Silicea patient in chilly, rachitic, or more precisely, the outlook of Silicea patient is as like as a quadricure patient. You know, my friends, that quadricure is a disease which is caused due to malnutrition, especially lack of bodily fats. Upper and lower extremities are emaciated, but the patient is pot-bellied. Silicea patient wraps up his head while going to cold environment. Head is sweaty, fontanelli, and sutures are open. Hands and face, or palms and face, sweat profusely, and sweat is offensive. The patient is to some extent scrofulous, that is, submaxillary and cervical glands may be swollen or tender, and the patient is susceptible to cold. Now, mind of Silicea. What is the texture of mind of Silicea? Silicea patient is yielding disposition. Patient is mild, no self-confidence, and no recuperative power under the impact of pressure. Want of grief, that is, loss of self-confidence. Now, one thing here ought to mention that Silicea patients suffer from malnutrition. But one thing here is to be kept in mind that there is no lack of supply of nutrients, but there is defective assimilation. That is, the Silicea patient gets adequate nutrients in the form of food. He ingests those foods. There is no major defect in digestion, but there is difficulty or defect in assimilation, and this is the cause of malnutrition of a Silicea patient. As a result, the patient suffers from systemic weakness or overall weakness, and the impact of weakness spreads in every system. As for example, the nervous system is enfeebled, the GI system or GI tract is also come under the ambit of this weakness. Even the musculoskeletal system also comes under the impact of this weakness. As a result, a significant symptom is seen in its rectum. The patient strains again and again to evacuate stool. It protrudes from the anus, but soon it recedes back again. It is because the rectum muscles are not so empowered to evacuate the stool due to weakness, or the nerves which are supplying the rectum and responsible for contraction of rectum are in defect. In Thuza and Sanicula, we also get this symptom, but we have to administer the medicine according to symptom similar. Now, Silicea patient walks late. It is because the musculoskeletal system is enfeebled and it do not support adequately to walk or standing process of the patient. Silicea ranks among the first of our remedies for inflammation, which turns into suppuration. But Silicea comes in the later stage after episulf or calcareous sulf, which expedite the process of pus forming, and Silicea helps in healing of the scar. Silicea headache is also very important. The headache is initiated in the back part or in the occiput. It travels through the head to the eyes. Vertigo also is there, and it is aggravated looking up. Silicea vertigo aggravated looking up, like pulsatina. And in this connection, we have to know that Silicea is the chronic remedy of pulsatina. Another important symptom for which Silicea is frequently indicated is that epileptic spasms which aggravate in new moon. It is a verified symptom, and many of our stalwarts has written about this symptom. So we should not forget Silicea in epileptic spasms which aggravates in new moon. Now we have to know another symptom, that is bad effects from suppressed sweat, as hands and feet or palms and feet of Silicea patient sweats profusely, but due to any occasion, due to exposure to cold environment or cold ice, the sweats suppressed and many bad symptoms appear. If Silicea is given, then the cause of this suppression is neutralized and patient is rescued. Another symptom of Silicea is the patient wants to be magnetized. Now, what does magnetized mean? It reflects a deep underlying psychological need for support, comfort, and direction from another person to alleviate their anxiety. It is also seen in phosphorus. Now come to modalities. Silicea complaints aggravated from cold or draft, motion, open air, and pneumonia, and ameliorated in warm room, wrapping up head and magnetism. Thank you, friends. Have a good day.